Periorbital cellulitis or preseptal cellulitis is an inflammation and infection of the skin and soft tissue around the eye, but it doesn't affect the eye itself or the globe. It happens mostly in children younger than 5. It is important to differentiate it from orbital cellulitis because they have entirely different implications and management. Periorbital cellulitis is a mild infection and rarely leads to serious complications, but orbital cellulitis can lead to loss of vision and sometimes it's life-threatening. Periorbital cellulitis happens when a bacteria attacks the skin or tissues around the eye, mostly from an external source, such as an insect bite, scratch, or any kind of trauma to eye. And sometimes the reason is inside the body, for example when the patient has influenza or bacterial common cold. This condition is usually unilateral, and the patient presents with pain, swelling, discoloration, or erythema of the eyelid and the tissues around the eye. Symptoms such as vision impairment, pain with eye movements, and ophthalmoplegia indicate orbital cellulitis, which must be treated right away. In most cases, preseptal cellulitis is diagnosed by the presence of swelling and pain in just one eyelid. Recent history of insect bite, trauma to eyeball, allergy, or recent upper respiratory infection such as flu or cold are supportive of diagnosis. In many cases, the clinical distinction between periorbital and orbital cellulitis remains unclear. It is when imaging helps us to find out the exact diagnosis. CT scanning of the orbits and sinuses allows differentiation between the two conditions. CT imaging in periorbital cellulitis demonstrates just eyelid swelling with no fat stranding or proptosis, and abnormal changes in fat tissue or eyeball in imaging indicates orbital cellulitis. CT imaging is also recommended in the presence of the fever and leukocytosis or high white blood cell level. Complete blood count and blood culture is unnecessary in this condition. It is recommended to perform them just in case we are unable to exclude orbital cellulitis. The first step of the treatment plan is to determine whether the patient needs hospitalization or not. Any children younger than 1 year, patients who are severely ill, and those who fail to respond to outpatient therapy in 48 hours should be hospitalized. Antibiotics should be started in all patients. Our choice of antibiotic is usually empiric, based on the susceptible microorganism, because the blood culture is rarely positive. The first choice of antibiotic, which is mostly recommended, is amoxicillin clavulanic acid. If the patient doesn't respond to therapy after 24 to 48 hours, or there is a history of allergy to penicillin, we should choose another antibiotic. Cefpodoxime and clindamycin are proper choices in this case. The ideal duration of taking any of these antibiotics is 5 to 7 days. Local corticosteroid ointments are useful to reduce inflammation and swelling of the eyelid. They can be used just for a few days. Long-term use would dry out the skin and make it fragile. Use a soft stuff such as an ear pick to gently apply it.